VA Women's Virtual Town Hall. I'm Dr. Normandin, Chief of Staff for Montana VA. My right is Sue Callentine. So she's Women's Veteran Program Manager, and I'll hand it over to her.
Thank you, Dr. Normandin. Well, good evening, everyone, and thank you for joining us tonight. We want to go over a general overview of all of our services that we have for our women veterans across the state of Montana. If you've called in, press *3 to ask any question, and you'll hear that more than once. If you've joined via the Access Live link, you may leave a question in the chat box, and if you're watching via Facebook Live, you can click this link to leave a question in the chat box. And remember, don't share your personal information. At the bottom of your screen, you'll see our patient advocates number in case you have any remaining questions or want to speak with someone directly about your case. This number is 406-447-7990. Well, why are we here tonight? Women veterans are the fastest demographic growing in the military. We see an increase in our women veterans directly related to that growth. And currently we have over 865,000 women veterans across the VA throughout our VA facilities. Here in Montana, we serve over 4,200 female veterans, although we have almost 9,000 in the state. So we're here tonight to provide this information to you, and hopefully you'll come join us here. We have an increase of about 3% every year in women's growth. So we want to continue to reach out and remind all of you the services that we have. You will be seen by a PAC team provider who has met very specific national criteria and guidelines to take care of women veterans. In our program, we have maternity care and coordination. We collaborate with our PAC teams to monitor breast health, breast cancer, cervical health, cervical screening, and cervical cancer. We provide infertility care and coordination, transgender care and coordination, gynecology care, pelvic floor health, and women's mental health. You can access all of these services in one form or another via video on demand, telehealth, or in person at all of our clinics. In-person gynecology is located at the Fort, Bozeman, and Billings, but also soon, very soon, matter of fact, we'll be able to offer these services in Great Falls, Missoula, and at our Butte Clinic. And you'll hear more about that from our GYN nurse practitioner. Towards the end of 2023, we will also be able to continue to expand our women's health services to our Kalispell area. Our Women's Veterans Health Team includes the following. We have a Women's Health Medical Director, Erin Gokul, nurse practitioner. She's also a primary care provider. We have two GYN or gynecology providers, Dr. Aiva Bailey and our nurse practitioner, Carrie Cunningham, who you'll hear from shortly. We have a Women's Health Infertility and Maternity Nurse Navigator, Catherine Shackelford, a Women's Health Breast Health and Prevention Nurse Navigator, Jeanette Ricks, a Women's Health Mental Health Champion, Cynthia Otter, and our Administrative Support Program Specialist, Shelby Formsman. We will also, later this year, also have a women's health pharmacist. So we will be adding that service to our program as well in March. Please invite your fellow women veterans to come join us here. We are also very excited to recently share with you that recently we have decided to do our very first women veteran-only virtual drop-in peer-to-peer group. We are starting in the Fort Harrison area, taking place in March. So for those of you who are already enrolled in the Fort Harrison PAC teams, you will be getting a letter out in the mail providing additional information about this peer group later in March. If you're not currently enrolled with us, that's not an issue at all either. If you're interested in participating, please call our Women's Health Team at 406-447-7337. Tomorrow, The Women's Health Team will be in Missoula celebrating the first anniversary of the opening of the David Day Thatcher Clinic and celebrating Go Red for Women, so stop by and see us. Now, let's hear from our Women's Health Team. First up is Carrie Cunningham. She's our GYN nurse practitioner. Carrie?
Good evening. As Sue said, my name is Carrie Cunningham. I'm a new addition to the Women's Veteran Program, specifically as the gynecology nurse practitioner. I have 15 years of experience as a nurse practitioner, with much of that being in women's health. And I work closely with Dr. Bailey, our current OBGYN, to provide office-based care and procedures, consulting with her as needed. Dr. Bailey and I offer a full spectrum of care, including routine breast and cervical cancer screenings, but also needs including contraception with birth control pills, IUDs, and Nexplanons. We also help with menopausal symptom management, evaluation and treatment of abnormal pap smears, any abnormal bleeding, pelvic pain, endometriosis treatment, polycystic ovarian syndrome diagnosis and management, vaginal and sexually transmitted infections, urinary incontinence, and osteoporosis, to name a few. We can help identify veterans at risk for genetic cancers and appropriately refer for genetic counseling and higher-level cancer screenings as needed. We can also start initial infertility workup and medication treatments for infertility. Infertility needing interventions such as artificial insemination and service-connected IVF are referred to community providers, as is all maternity care once a veteran becomes pregnant. I have quickly learned the unfortunate rate of military and other sexual trauma that many of you have experienced, and I work diligently through trauma-informed care to make all women's experience with me as safe and comfortable as possible. Dr. Bailey is a skilled GYN surgeon and offers surgical procedures both in Billings and at Fort Harrison, although higher complexity cases can only be offered at Fort Harrison. These procedures include DNCs and hysteroscopies for bleeding, uterine ablations, cervical cone biopsies, cautery of endometriosis, removal of fallopian tubes for desired permanent sterilization, and/or ovaries if indicated by abnormal findings. Even pelvic exams can be done under general anesthesia for extreme cases of MST. As increased complexity of surgical cases is expanded, Dr. Bailey will expand her offerings accordingly. As Sue said, starting this month, our GYN footprint will be expanding pretty significantly. I will remain here as my base and travel to Butte, Great Falls, and Missoula. Dr. Bailey will continue to be in Billings, Bozeman, and then at Fort Harrison as well. We are equipped to provide all GYN office procedures in all of these locations. We will continue to have video visits for medical management of conditions and follow-ups when appropriate. Please reach out to your PACT provider for a referral if you would like to initiate care with us.
Thank you, Carrie. Appreciate that information. And remember, *3 with any questions for us. Okay, next, over the phone, we'll be hearing from our maternity and infertility nurse navigator, Catherine Shackelford. Catherine?
Good evening. I'm Catherine Shackelford, the Montana VA Women's Health Maternity and Infertility Nurse Navigator. Montana VA offers maternity care in the current medical benefits package to all women veterans who are enrolled and are eligible for VA health care. Maternity care is sent out into the community by referral from a VA provider. Care that is covered in the maternity authorization is routine prenatal, delivery, and postpartum care, as well as newborn care, both inpatient and outpatient, for the day of birth and following 7 consecutive days. As the maternity nurse navigator, I provide care coordination via telephone or video visits. I reach out to veterans at least once a trimester during pregnancy and postpartum timeframe, and more frequent when needed. I will also be following women up to 12 months postpartum to offer support and connect with resources for concerns with postpartum depression, home and food insecurities, and lactation. During our visits, I will complete screenings such as tobacco, alcohol, depression, interpersonal violence, and connect with resources as needed. As the maternity nurse navigator, I can assist your OB provider with getting needed paperwork to the VA so that authorizations can be obtained for care the OB may refer you to, such as physical therapy, chiropractic care, or IV infusions. I am a certified lactation counselor and will provide breastfeeding education and support during pregnancy and postpartum. The VA provides breastfeeding supplies, and an order will be placed through prosthetics around 28 weeks gestation that will include a breast pump, nursing bras, and other supplies. As the maternity nurse navigator, I work closely with our pelvic floor therapist and will assist with getting women veterans connected if care is needed during pregnancy or postpartum. I also work closely with our women's mental health champion and can connect our women veterans during pregnancy and postpartum. As Carrie just said, Montana VA provides infertility care to veterans who are enrolled and are eligible for VA health care. Initial workup for reproductive health can be provided by our VA gynecology staff that may include menstrual cycle counseling, laboratory testing, and hormonal therapies. Women veterans can receive services such as infertility assessments and counseling, imaging services such as ultrasounds and x-rays, surgical correction, genetic counseling and testing, fertility medications, artificial intrauterine insemination or IUI, and tubal ligation reversal. IVF or in vitro fertilization is also covered by the VA if eligibility is met for veterans and their spouses. Eligibility is determined by a service-connected disability and clinical judgment of the healthcare provider. Eligibility requirements include the veteran must be legally married, the veteran must have a service-connected condition causing the veteran's infertility, the veteran or spouse must have an intact uterus and at least one functioning ovary, and the veteran or spouse must be able to produce sperm. Surrogacy, as well as donated sperm or eggs, are not covered benefits. As the maternity and infertility nurse navigator, I assist with providing education and answering questions on what care is covered by the VA. For further questions regarding reproductive health, please reach out to your VA provider, or you can contact me directly at 406-874-5624, or you can send a message through My Healthy Vet secure messaging at maternitycare_VA Montana_WVP. Thank you.
Thank you, Catherine. Up next, now let's hear from our breast health and prevention nurse navigator, Jeanette Ricks.
Good evening, everyone. My name is Jeanette Ricks. I'm a breast health and prevention nurse navigator with the Women's Health Program. My role as a breast health nurse navigator is to ensure veterans receive preventative and diagnostic breast health care. You may not be aware these services are available through the VA under your benefits package. We do offer the ability to have annual screening mammograms, diagnostic mammograms and ultrasounds, MRIs for people of high risk for breast cancer, breast biopsies, and breast cancer treatment and follow-up care. Veterans Health Administration follows the American Cancer Society or ACS guidelines for breast health management. Annual mammogram screenings are recommended every year for women aged 45 to 55, and every other year if you're of average risk between the ages of 55 and 65. Women of 55 to 65 age group can continue to have annual screening mammograms if they wish to, and a baseline mammogram can be performed at the age of 40. If you feel that you are at high risk of developing breast cancer, our gynecology service can do a high-risk breast cancer workup for you and determine if genetic testing may be an option for you or if additional screening may be recommended. Mammogram imaging itself is not performed within VA facilities. These images do go out into your local community. It does require a community care consult to be entered by your primary care provider, or you can contact me to help with that process as well. Community care will contact you when your consult has been processed and ready for scheduling. You'll get a call and a letter asking which local facility you would like to be seen at. From there, you will call the imaging facility yourself and make an appointment for the time that's convenient for you. Please let the VA know when that appointment is scheduled for so we can call and request the records in a timely manner and let you know the results. Please note that the radiology facility will notify you of results, and the VA provider will also notify you of results. You can feel free to reach out to me for any questions regarding your mammogram or the results or interpreting them. The initial screening consult for mammograms does include all follow-up care that may be needed, so there's no need to request repeat consults. Mammograms are rated using a score called the BI-RAD system with scores of 0 to 6. You'll see that noted on your report. Your breast density is also noted on your report and is important to know. Very dense breast tissue can obscure small masses, so in this case, we do recommend additional imaging at times. You can learn more about the specifics of mammograms at www.cancer.org and search for mammograms. It's also important to learn your family history of all types of cancers on both sides of your family. It may be recommended you have more frequent care if certain cancers run in your family. The VA does offer genetic counseling and testing for those at high risk. If a breast cancer is confirmed, the VA will place oncology and general surgery consults and possibly a plastic surgery consult if you feel that's the right path for you. We can also provide specialty bras and prosthetic breast inserts if that's what you choose as well. I will check in with you during your treatment process and make sure your general surgery and oncology consults stay up to date. I'm always happy to listen or answer any questions that you may have. My phone number is 406-447-7343. I do have voicemail that's secure, so you can leave any information. I'm available by My Healthy Vet at Women's Veterans Health Program, Fort Harrison _WVP. And you can learn more about cancer at www.cancer.org. Thank you.
Thank you, Jeanette. Now, up next, we will hear from our Rehabilitation Services team, Dr. Hannah Marin, to talk about our pelvic health program.
Thank you, Sue. Hi, my name is Hannah Marin, and I am a physical therapist and the VA Montana Pelvic Health Program Coordinator. I'm located here at Fort Harrison. Pelvic floor physical therapy is offered to all veterans across the state through face-to-face or video appointments. I work in conjunction with many healthcare services, including primary care, gynecology, nutrition, mental health, maternity care, gastroenterology, and urology. Pelvic health physical therapy focuses on people with problems with their bladder, bowels, sexual function, or issues before and after pregnancy. The muscles of your pelvic floor are just like the muscles in the rest of your body. Some muscles may not be working like they should, or some may have had an injury and need PT to help. If you have problems or issues related to these, please talk to your primary care provider. If they don't know about an issue, they can't help you. If you are pregnant or postpartum, pelvic floor PT can be very beneficial in the prevention of problems and also help with musculoskeletal pain associated with pregnancy and birth. Some of you might also feel that your current pelvic floor symptoms are normal. You might be thinking, so I leak a little when I cough, laugh, or jump on the trampoline. That just happens as we get older. Well, that isn't normal, and there may be some things that pelvic floor PT can help with. If you are wondering about your own symptoms, I offer a 1-hour healthy bladder class by live video or face-to-face to help people understand how the bladder works, what is normal, and what can you do to help yourself if you are having issues. This can be in a group setting or individual. If you are interested in this, please contact the Women's Veterans Coordinator at 406-447-7336. We are all here to help you get the care that you need. If pelvic floor PT is something you feel you need, please reach out to your provider and they can discuss if pelvic floor PT is right for you. Thank you for your service and have a wonderful weekend.
Thank you, Dr. Marin. I want to talk a little bit about our primary care services this evening. Primary care at the VA is through PACT. PACT stands for Patient Aligned Care Team. The team is comprised of clerical staff, nurses, and providers. Montana VA Primary Care has over 33,000 veterans enrolled in care. We provide primary care at 15 clinics across the state via in-person and telehealth visits. All of our providers in primary care are Women's Health certified, as I mentioned earlier, which means they have all undergone very specific training related to the concerns and needs of our women veterans. All of the Montana VA's primary care providers can provide routine and even some acute women's health care. We have pregnancy testing available at all of our clinics across the state. All of our new clinics, which we're very proud of, have dedicated women's health exam rooms with attached bathrooms, which can help streamline very sensitive exams. The average wait time for established patients to get an appointment with their primary care provider is about 6 days or less at all the clinics across the state. Now, I'd like to switch gears and hear from our mental health team. Our Women's Health Mental Health Champion, Cynthia Otter. She will be coming up to provide some information about that part of our program. Cynthia?
Thank you, Sue. I'm Cynthia Otter. I serve as the Behavioral Health Outpatient Therapist and Women's Mental Health Champion here at Fort Harrison. I want to start off by thanking all of you for your service and joining us tonight. We're working really hard to get the word out about everything that we have here and all the mental health services that are available. And I'm honored to champion mental health services and I'm honored to champion the mental health services for women veterans in Montana. And as the Women's Mental Health Champion, I work in collaboration with many of the folks that you just heard from, and to ensure that you guys get gender-specific and gender-informed mental health care. My role as the Women's Mental Health Champion is to support, advocate, and assist with the coordination of care for all women veterans and their unique needs and experiences. And trust me, in the short time I've been doing this position, there's a lot of unique, different circumstances, and we're here to help you with that. In Montana, we are continuing to expand and grow our outpatient mental health services that include highly trained, trauma-informed clinician, peer supports, whole health services, military sexual trauma services and support, suicide prevention specialists, crisis line support, substance use disorder, PTSD services, pain management clinic, LGBTQ services and supports, intimate partner violence services, and many other services that are available to veterans. As mentioned in previous women's town hall meetings, there's been many requests from women veterans for increased group offerings both in person and virtually. Sue mentioned earlier about our newest offerings of a peer support group that will start in March. And we are also continuing to explore how to work in collaboration with our community-based outpatient clinics to make more groups available to women veterans across all of Montana. And we are happy to announce that we have our first virtual group to support prenatal and postnatal care beginning next week. The program ROSE, which acronym means Reach Out, Stay Strong Essentials, with the group focusing on prevention of postpartum depression. The VA has many acronyms, but I feel ROSE is fitting, and my true wish as the Women's Mental Health Champion as we expand services is for all women veterans to reach out, stay strong, and utilize the supports available to you. As a point of contact for women's mental health, I want to share my direct phone number, 406-447-7336. 6033. You can also reach me by contacting the Behavioral Health Department here at Fort Harrison at 406-447-6000. And the last number I want to share with you, which in my short experience at this time is many women veterans don't know this is available, but there is a Women's Veteran Call Center number, which is 1-855-829-6636 or 1-855.va.women. This is not a crisis response line, but rather a way to connect with available resources and benefits specific to your needs and questions. Thank you and be well.
Thank you, Cynthia. Remember, any questions? *3, and we'll get to your questions once we finish hearing from the team. Okay, now joining us via phone is our Intimate Partner Violence team, Vance Lavender.
I'm sorry, Sue. I didn't know I was talking today. My name is Vance Lavender. I'm the Intimate Partner Violence Assistance Program Coordinator for the state of Montana. To update our program, we've been implementing the Strength at Home program, which is a program dedicated to ensure a safe home environment for everyone that is in a relationship. It teaches people how to communicate more effectively and be a better partner in their relationships. We also assist providers at Montana VA to make sure that they are able to respond to disclosures of intimate partner violence, and just to be sure that intimate partner violence is not just kicking, biting, scratching, things that would be a law enforcement issue, but they're also how we speak to each other. And we would like to make sure that we assist people at the lowest level in order to make sure people are able to have a successful, intimate relationship with their partners. Thank you very much for your service, and have a great weekend.
So we changed up the agenda a little bit, so I appreciate, Vance, you digging me out of the hole I just dug myself into. So thank you. It takes a team, right? So, all right. So we've heard from everybody. Again, *3 for questions. We hope this information helps connect you to want to take advantage of the services that we provide here in Montana. Those are services that, you've heard many folks say tonight, we thank you for your service. And thanking you for your service, also in a way of thank you, we want to make sure that you get the services you deserve, and high quality services. And we really have put together a team that's able to help provide those services for you. Again, if you've called in, press *0 or *3 to ask a question. If you joined via the access link, you may leave a question in the chat box. So let's take a few questions from our veterans.
Our first question is for Jeanette. Are breast reductions available?
Breast reductions for cosmetic reasons are not covered. However, if you feel that you have a medical necessity that qualifies you for a breast reduction, you can contact your primary care provider and have a consult placed for evaluation to see if you meet that criteria.
Thank you, Jeanette.
Our next question is for Dr. Marin. Dr. Marin, I'm wondering if the VA will do a referral for the MSLA there, and will you be at the clinic opening in Missoula tomorrow?
Okay, so that VA does not cover the MSLS, and so there's other things that we can do because pelvic, it is better to actually actively work your muscles than do something passively. So there are other things that we can do to help with that and other tools the VA will provide to help you with that. And I will not be at Missoula tomorrow, but I am available for video appointments. So even if you are not in the Helena area, I would be happy to talk with you and set up an appointment if you have questions. And then if we do need to get you further care that will not be able to be provided over video, then we can always get you community care, pelvic health in your local area.
Thank you, Dr. Marin. Those folks that will be in Missoula tomorrow will be Carrie Cunningham, our GY nurse practitioner, and myself.
Thank you. This next question will be for Cynthia Otter. What are the resources for MSP victims in Montana?
Yeah, right now, MSP victims, and Dr. Mary and I were just talking too about some of the pelvic floor folks who've been requesting more services. Right now we have mainly individual therapy with a lot of highly trained clinicians. Our MSP coordinator takes the initial call to talk to you about benefits through VA benefits administration, filing a disability claim if that's the direction your MSP claim goes. And you also are entitled to a one-time physical evaluation as is related to that MSP. So at this point, I know we've had requests for an MSP group as well. We don't currently have the services to do that in a group setting, but we're working on it, and we'll see if we can get something going here real soon.
Before you leave, I have one more question for you.
Okay.
Can you please reshare your phone number?
My direct line?
Yes, please.
406-447-6033.
Thank you.
And an alternate phone number for that is 406-447-6000 because I do not have at this time voicemail.
Thank you. And one other question, do you know if there is a specific veterans advocate for women veterans who have issues with abuse? Someone who would be able to help educate the community as well.
Veteran advocate is
Maybe Vance, would you like to speak to that? That might be more in Vance's purview.
I think I could. It sounds like when we're talking about experiencing like intimate partner violence, perhaps we have trained behavioral health and PAC social workers to address issues and provide assistance. We have a list of agencies throughout throughout Montana in all 56 counties. I think I'm right when I say 56. On all 56 counties for shelters and advocates in the area. And my personal phone number for the VA is 406-439-1786. If you'd like to talk further, I can certainly discuss different options for people that need assistance.
Thank you, Vance. Appreciate that information. And thank you, Cynthia.
Yes, thank you. This question is regarding hormonal testing for Carrie Cunningham. What exactly should be provided for pre- and post-menopausal testing and support?
That's a difficult question and no cookie cutter answer for that. In general, for peri and postmenopausal women, we treat symptoms rather than numbers. And so really it's a conversation with your provider about how you're feeling and what's going on. Sometimes labs are indicated. In general, not necessarily, but really looking to find medications, hormonal and not hormonal, depending on your full medical history to make symptoms better. So even though not always do women need and or want estrogen for hot flashes, let's say, certainly there are other medications with less side effects or different side effects that can be very effective. So unfortunately, there's not one straight answer for that. It's really more of a conversation with your provider.
Thank you, Carrie. Appreciate that information. And remember, if you've got a question you'd like our resource group, they're right here. They're available for you. Please dial *3 and we'll answer your question if time allows.
Thank you. Our next question is for Dr. Marin. With the pelvic program, does that help with bladder incontinence?
Yes, that is one of the specific things that we do work with. And pelvic floor physical therapy can be very helpful if that is a musculoskeletal problem. There could be other things going on, so that's why I work highly with the urologist, GYN, and everyone else that can help in that realm.
Thank you. And I'm not certain if you can answer this question,
Okay.
but there's another one of, after I had my child, the muscles in my abs have spread. Is there any care for that?
Yes, definitely. And that's something, again, that I would treat. That's called a DRA. And so what we're looking at is just trying to see if we can bring those muscles back together. And so I would definitely ask your provider for a physical therapy consult for that.
Thank you very much, Dr. Marin. This question is for Jeanette. With breast cancer, if you have a mastectomy, will the VA cover reconstruction?
Yes, they will cover reconstruction if the VA has authorized your oncology, general surgery, and plastics consult.
Thank you. And just also wanted to let everybody know that with the phone numbers, they will be shared via Facebook Live, which will be available about 15 minutes after our town hall ends.
Thank you, Shelby, for that reminder.
Yeah, thank you.
Any other questions from our women veterans out there? Looks like we have quite a few. So next up is?
I have another question for Jeanette about screening mammograms not being covered for females over 60 years old.
Screening mammograms are absolutely covered for women over 60 years old. ACS guidelines, American Cancer Society, for the average risk woman from 55 to 65 is every 2 years. However, the VA does offer women veterans the chance to have annual mammograms if they wish to. So absolutely. If you have any trouble with that at all, give me a call, 406-447-7343.
Thank you, Jeanette. Our next question from Facebook, can I request to see a female provider?
Okay, I'll take that. Yes, you absolutely can. You work with, if you currently have a male provider, you can request that through the Veterans Experience Office and ask them. It takes if you currently have a male, there'll be a form you'll need to fill out, and they will do their best to get you under the care of a female provider. Yes, absolutely.
Wonderful, thank you.
Any other questions? Remember *3 to get your questions answered tonight. We've got all these folks here just for you. We've got patient education here as well, and we've got our folks online.
I have a question for Tina in enrollment. How do I find out if I am eligible for care within the VA?
That's a very good question. So the easiest way to find out if you're eligible for care in the VA is to get a hold of one of our patient business offices, and we have several throughout the state, and fill out what's called a 1010EZ form. Submit that to the office with a copy of your DD-214s, all of them, and your enrollment determination will be made at that point.
Thank you, Tina. I have a question for Dr. Marin. After I had my child, the muscles in my abs have spread. Is there care for that? And I guess that's the only question, and you answer.
Yes, so definitely that's one you would like to request physical therapy for, and we can take care of that. And we also can take care of that. Physical therapists in general work with that too. So if you are located in Billings, Miles City, or Missoula, we have physical therapists there that can help with that.
Thank you. Question regarding transgender care and how do you get the ball rolling?
Certainly, transgender care is something that Dr. Bailey and I are able to provide. So if that's something that you would like to chat with us about, again, just request a referral through your PACT provider.
Thank you. I have a question for Cynthia. What would you do for a mental health patient with agoraphobia?
Right now, thanks to COVID, I think, we have some really great services for care right from your home. VVC, which is a video connection. If that's not something you're comfortable with, we can also reach out and do phone therapy, work with you about treating the symptoms of why your agoraphobia is in, what your anxiety is about, where it originated from, and have the trauma help that you need. So that's probably how I would address it at this point, is through that, so that you wouldn't have to feel like you have to get into the clinic. In fact, a lot of veterans have a hard time coming up here. It's working on the trust, working on knowing that there's good support up here, and sometimes they start off with that care through telehealth instead.
Thank you, Cynthia.
Thank you.
I think we've got a few more, little bit more time for a few more questions.
We have a question regarding the MOVE program. Does Montana VA have a MOVE program, and are there any specific programs available for weight management?
So that will be Helen Williams.
Helen Williams will be coming up to answer this question.
Thank you, Helen.
Thank you for your question. My name is Helen Williams with Health Promotion and Patient Education. We do have a free MOVE program, which is a weight loss program. Every VA does offer that. We have our champion with the MOVE program has lots of different options for how we can deliver that. In-person, telephone, telehealth. They have an app. So there's it's a free consult, a free referral to that program. So you could just ask really any of your providers, any of your clinicians for that. And then I do want to just give a pitch about another option we have called the Telephone Lifestyle Coach. It is a free telephone-based coach that can help you if you're setting up your own goals for healthier habits with nutrition or activity or stress, limiting alcohol, but not to the point where you would need treatment. So it's connecting you to a phone coach, and you set up the time when you want to talk to them, and you have up to 10 visits over the course of 6 months. That's a really wonderful option. People who've been enrolled in that program report a 98% success, 98% satisfaction about that service. So it's a great one to consider as well. Thank you.
Thank you, Helen. I have a question. If somebody was seen by Dr. Meganito, who is no longer here, do they have to go back to their PCP, or who do they see now? Carrie Cunningham, can you answer this question?
We can certainly, Dr. Bailey or myself can certainly see patients who had been previously established with Dr. Meganito. As long as it's been in the last 2 years, please correct me if I'm wrong, no new referral is needed.
Thank you, Carrie.
Thank you.
We have a lot of questions asking for phone numbers to be repeated or resources to be shared. We will send an email out with all of this information as well. We have an additional primary care question. Will there be more providers on the eastern side of the state being added, especially female providers?
Yes. I'll take that one.
Okay.
Thank you, Dr. Normandy.
Yes, the intent is to expand our primary care presence throughout the state, in particular in the east, where there's a lot of growth, as well as throughout Montana. We're all experiencing that. But the specifics of who's going to be where a lot of times depends on our base and availability to place a provider in that space. So we're working on recruiting. We're being very successful in recruiting. So I would, even keep in touch with the team here to find out more specifics closer to where you live, and definitely reach out to the team. I think is the best way to keep tabs of who is new to the staff. But yes, we are expanding.
Yeah, thank you, Dr. Normandy. And I will add as well, this is something that comes up in our focus groups. We have focus groups once a quarter, so once every 3 months. And this gets brought up every focus group. And so we realize that many women veterans don't care what provider they see, but there are some that want specifically a female provider. So we do know that's a request. Dr. Normandy and his team's working very hard to be able to get the providers across the state that we need. And we appreciate that question and know that it is something that we address and problem solve and think about quite often. So thank you.
Thank you. And I just want to share our Women's Mental Health Champion, Cynthia Otter's phone number one more time. It is 406-443-6000.
447.
447. 6000.
Yeah, and while we're waiting for the next question, I may as well review a couple other phone numbers while folks are writing phone numbers down. Remember, *3, couple more minutes for questions. The patient advocate or patient experience office phone number is 406-447-7990. The crisis line is 998. That's it. That's all you have to dial. If you find yourself in crisis, 998, press 1. You'll get immediate attention. Very important phone number to have. To schedule an appointment with your primary care, it's 1-877-468-8387 and press 2. I'll give that one more time. For scheduling appointments with your primary care, it's 1-877-468-8387 and press 2. For community care questions, if your provider told you they put a consult in and you haven't heard anything from anybody, the CITC call center number is 406-447-7400. Again, that's 406-447-7400. Now, let's say you're in need of transportation to get here to see us or to get to one of the other clinics. The transportation services phone number is 406-447-6270. Again, that's 447-6270. And travel pay, very important. If you are traveling yourself and driving yourself and you're wanting questions answered about travel pay, that phone number is, again, 406-447-7409. Again, 447-7409. All right, to finish up, ladies, do we have a few more questions yet we can fit in?
We do. I have another question for Tina. I already have a disability through the VA, but how will I get set up with a provider?
Very good question again. That's excellent that you already have your disability through the VBA. The way to get it set up for a provider is to fill out that 1010EZ and submit your DD-214. It gets you that enrollment process started, and from there we'll get you to the scheduling line. And we have patient business offices at Fort Harrison, Billings, Montana, and Missoula. So if you have any questions, please feel free to call me at 406-447-6270. 7325.
Thank you, Tina. Is there a central location where this information is available that we can access about women's health care?
Yes, thank you for the question. We do have an external-facing Facebook page, or Facebook page. If you have any questions or need additional information, you can go to the VA Montana internet page and go down to Women's Health. You click on that and it has our information. It has the Women's Health Team information. It has my cell phone number, and I've not provided that yet tonight, so let me do that. It's 1-406-438-1684. That's 438-1684. So again, go to our internet, the Montana VA internet page, go down to Women's Services, and it'll have some information on there for you. Good question.
Thank you. And I just wanted to clarify, the crisis line phone number is 988. I also have Lauren on the line who would like to share a little bit as well.
Hi, my name is Lauren DeFrancisi. I am a social worker on the suicide prevention team, and I just wanted to do a little shout out for 988. Some of you may have heard that the number transitioned over from that long 1-800 number. That's kind of hard to remember. And then, so I also want to just explain a little bit what happens when you dial 988 and then what happens when you dial 988+1, which is the Veterans Crisis Line. So if you dial 988, you're going to get connected to one of our 3 call centers in Montana. So they'll be knowledgeable about Montana resources and struggles specific to our state. But then if you press 1 and get involved with the Veterans Crisis Line, you will be connected to somebody who is potentially not in Montana, but does have more knowledge, some more competency on the military and veteran life. And as well, a benefit to pressing 1 is that if you'd like during the call, you can, the responder will ask if you'd like to have a suicide prevention consult. So what that means is you will then receive a follow-up call from someone on my team within 1 business day. And, depending on what the issue is, we can potentially get you into care, we can provide resources. So you will receive a call back from someone, directly on our team, and we can hope to get you connected there. And then, of course, depending on the nature of the situation, there's also the ability to call in emergency services and that type of thing as well. Thank you.
Thank you, Lauren. We have one additional question asking about the time of the event in Missoula tomorrow.
So in Missoula, the information tables, including the Women's Health Team, will be there between 10 and 2 in the afternoon. And again, that's at the David J. Thatcher Clinic. We opened it a year ago. We're celebrating that anniversary of opening, as well as Go Red for Women. And this is just a little plug of my own. February is Go Red for Women. The national day is tomorrow, the 3rd. Cardiovascular disease is the #1 killer of women across the country. And so every year we celebrate, we along with the American Heart Association celebrate and bring attention to women's health, cardiovascular disease. And so you'll see, if you're able to stop by and say hi to us, you'll see a lot of us in red. So, but please feel free to stop by.
Thank you, Sue. And I have a shout out from Nancy. Nancy just wants to say that she's been retired since '87 and would like to say thank you so much to everyone on this committee. Her care has been absolutely wonderful.
Well, thank you very much. We certainly appreciate that, Nancy. We are excited about what we've been able to grow since then, and we have much further to go and additional services to bring to you and all your women veterans. So thank you for that compliment. I will share that with the team that's not here, and for those of us that are, we certainly appreciate that. Thank you. Any other questions, ladies, before we close? I know we're getting close. So again, *3 if you have any questions. Otherwise, have we gotten everybody taken care of?
We're just going to review one more time, but I think that's all of our questions and all of the time we have.
Okay. All right. Well, before Dr. Normandy closes us out, I do want to provide a couple additional reminder phone numbers. If you have any questions that we've not been able to get to, or you think afterwards, man, I wish I would have asked that question, there's always ways that you can reach us. If you have more questions, please call the Veterans Experience Office. Again, the number 447-7990. To contact your primary care team, there is My Healthy Vet. One of the speakers today spoke about that. As a resource, you're able to check your appointments, refill prescriptions, get a copy of your medical records, message your provider. That's at My Healthy Vet. Set up an appointment with your primary care team. Again, that number is 877-468-8387 and select number 2. This town hall will be recorded and saved to our Facebook page. To stay up to date, follow us on Facebook, searching for either Montana VA Healthcare System or type in @VA Montana. We are also on Twitter and Montana as Montana VA Healthcare System. So we are in the digital world. Please refer a veteran. Tell your women veteran friends about us, the services that we've been able to share. Thank you all for doing what you've done, for serving your country. And Dr. Normandy, would you like to close us out, sir?
Sure. Thank you, Sue. First off, thank you all for your service. But I would also like to thank the team. You have a great team, great resource here. Please take advantage of it. They're part of the Chief of Staff line, so they make me proud, proud to be part of it. So again, reach out. Do not hesitate. These are resources that you can definitely utilize in various fashions, however you deem necessary. Please join us for our next town hall on Thursday, September 21st. So more information will come out closer to the time. But again, thank you for joining us, and have a nice evening.